Good morning. My name is Candice Daniels, and I will be presenting a discussion on Aboriginal and Torres Strait Islander health disparities amongst urban communities focusing on diabetes. Before I start this presentation, I would like to begin with a welcome to country. I acknowledge that we are meeting today on the traditional lands of the Burramadigal people of the Darug Nation. I offer respect to their elders, past and present, and to all traditional custodians of the land. Our research has been drawn from myself and my two other group members, Anshal and Jing. Combined, we have studied the links between culture and Aboriginal and Torres Strait Islander health and examined the underpinning reasons why there is such an existing gap between Aboriginal and non-Aboriginal peoples existing throughout urban communities in Australia. From this, we focused on the social determinants of health that increase the prevalence of diabetes, concentrating on low socioeconomic factors, education, income, access to services, and location, thus linking to the inexcusable disparity in health status and the careful considerations required for safe nursing practices in order to be culturally competent. What underpins this presentation is the inextricable connection that Aboriginal and Torres Strait Islander hold with the land, and how this connection has been lost and thus ultimately tarnishing their perceptions of healthcare now in Australia, subsequently leading to an increase in chronic conditions and shorter life expectancies than non-Aboriginal and Torres Strait Islander peoples living in Australia. I will now play this short YouTube video, which is a scenario between a nurse and young Aboriginal mother suffering with asthma, so you can understand and have a deeper insight to the relationship between both Aboriginal and non-Aboriginal peoples in the healthcare setting and the tensions that exist.
Hi, Hayley.
Hi,
My name's Sarah. I'll be your nurse for this afternoon. How are you feeling?
I'm okay.
Okay. And how's your breathing going?
Yeah, so.
All right. So, Hayley, I just wanted to ask you a few questions, if that's okay. So, I can see here that you're a smoker.
Only a social smoker.
Okay. Look, you probably shouldn't be smoking at all, considering you've got asthma.
Yeah. Work's been really stressful and I picked it up again.
Okay. And what sort of work do you do?
I'm a social worker at the Aboriginal Health Service.
Yeah, I actually used to be a social worker, so I know what it's like.
Yeah, work doesn't really finish at 5 p.m. for me. I mean, it's pretty much 24/7. Don't get me wrong, I mean, I love my job and I do whatever I can to help my people, but I think it's taking its toll on me.
Yeah, that must be really hard.
Yeah.
So, Hayley, I have to ask, are you Aboriginal?
Yes, I am. And yes, I know you have to ask.
Yeah. And would you like to see our hospital liaison officer?
No, I'm fine, thanks.
Okay. Now, Hayley, do you have an asthma management plan?
No, but I think I should get one.
Okay, well, we can get one for you while you're here. I think it'll be good for you. Do any other members of your family have asthma?
It runs in my family, actually. My eldest daughter has asthma and my sister has asthma as well, but only my eldest daughter's got the asthma plan.
Okay, so your daughter does have an asthma plan?
Yeah, my daughter Chloe, she's got the asthma plan, but none of my other kids have asthma. Actually, my sister should be here shortly.
Okay, I can get your sister a referral if you like.
Good luck.
All right, no worries. Well, give me a call if you need anything else. Oh, hey, what's going on? Where are you going?
Mum's not feeling well. I have to go.
Ah, look, the doctor did say that you were meant to stay for another night. I don't think you really should be going home yet.
Look, my family's had some issues with hospitals before. Racism, discrimination, plus I've got some family things that I need to sort out. I have to go.
Look, I'm really sorry to hear that. Look, here's my number. Please give me a call if there's anything I can do. Is it okay if I still send out some asthma management plans for you?
Yeah, of course. Right. Come on. Mum needs you at home.
Aboriginals have been forcibly and undoubtedly subjugated into a culture unnatural to the antiquity of their past. It's from the events that began in 1788 when the European invasion occurred in Australia, which has caused a grief backlash to the level of distinction in Aboriginal and Torres Strait Islander health. The Australian government provides us with the definition that Aboriginal health is not merely the physical well-being, but it also includes the social, emotional, and cultural well-being of the entire community, where all the members have the ability to reach their full potential as a human being, thus contributing to total well-being of the community. However, it was not long until both the social and cultural fabric of Aboriginal communities was diminished and thus was their spiritual connection to country. Subsequently, this ongoing conflict between government policies and Aboriginal and Torres Strait Islanders has impacted through generations to perceive only a negative perspective on both health services and perspective of health and illness in Australia. Therefore, Aboriginal and Torres Strait Islanders have increased factors to being diagnosed with chronic conditions such as diabetes. What is diabetes? Formerly known as diabetes mellitus. To put it simply, it is a condition recognized by increasingly high levels of glucose in the blood, resulting from the body being unable to produce and/or use insulin effectively. It is also the world's fastest growing chronic disease. Diabetes Australia explains that there are 3 important things you need to know about diabetes. Firstly, that there are 3 types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes, which occurs through pregnancy. Second is that no matter which type, all are intricate and require daily care and management. And thirdly, diabetes does not discriminate. Any person can acquire diabetes. From our research, referring to graph 1.1 from the Australian Bureau of Statistics, it is evident that as Aboriginal and Torres Strait Islanders age, so does their increased risk of developing diabetes. Burrow describes diabetes as a daily challenge for primary healthcare settings as it has reached an epidemic in Australia. He also states that Aboriginal and Torres Strait Islander children are 8 times more likely to develop type 2 diabetes than their non-Indigenous peers, and that Aboriginal and Torres Strait Islander people are 6 times more likely to die from diabetes than non-Indigenous Australians, which I will explain more in depth come the next slide. It is from this that we can gather that due to children being 8 times more likely to develop type 2 diabetes, that it can stem from their social and cultural determinants of health, such as families and or parents' low socioeconomic status and not having healthy food options available. The factors majorly contributing to diabetes amongst Aboriginal and Torres Strait Islander people reflect a combination of broad social, cultural, and historical factors, as well as proximal health risk factors. As previously stated, the rate that children developing type 2 diabetes that are Aboriginal and Torres Strait Islander is 8 times more likely. The updated Closing the Gap program from the Department of the Prime Minister and Cabinet quotes, "Without good nutrition, infants cannot thrive, children cannot succeed at school, and employment opportunities are diminished." In one sentence, this sums up the social determinants of health impacting Aboriginal and Torres Strait Islanders as a whole, of all ages and communities. That is, that low socioeconomic status drives the correlating factors of employment opportunities, which hand in hand leads to either increased or decreased socioeconomic status, leading to either poor or adequate nutrition. Firstly, low socioeconomic status is a major driver in impacting an individual's health. It is said that many Aboriginal people experience disadvantage through a lack of access to education, employment, income, and housing. Linking low SES with diabetes, adults who have a low socioeconomic status are more likely to die prematurely from diabetes and have more chronic disease risk factors than those of high socioeconomic status. Evidently, this is true for Aboriginal and Torres Strait Islander peoples, where life expectancy is much lower than non-Aboriginal and Torres Strait Islander people. As type 2 diabetes can be developed later on in life, there are key factors linked with social determinants of health, which highly increase the prevalence of diabetes for those communities. Burroughs found that in 2012 to 2013, Aboriginal people were more likely than non-Aboriginal to be overweight or obese, have low blood pressure, and were less likely to meet the daily guidelines for both fruit and vegetable intake. According to Wilson, for a majority of Aboriginal people living in urban areas, the westernised rich diet consisting mostly of saturated fats and refined carbohydrates has replaced the traditional hunter-gatherer lifestyle that was filled with good essential nutrients and fundamentally linked to physical activity. Therefore, inhibiting factors responsible for diabetes among the Aboriginal people living in urban areas. Low socioeconomic status then comes into play, as these families or individuals may not be able to afford healthy and nutritious foods to meet these requirements, whereas the cheaper option is fast food outlets and foods high in sugar or fats. In urban areas particularly, as there is easier access to these fast food stores and therefore more convenient and increasingly common to eat throughout the week. It is from this that creates this high prevalence of risk factors for diabetes to develop, such as Aboriginal people having higher rates of obesity and sedentary lifestyles. Access to services is a high influencing social determinant of health in terms of diabetes and any chronic condition for that matter. Even though urban areas are highly populated with Aboriginal and Torres Strait Islander individuals, it is from this negative perspective of health whereby the readily health services available may not be culturally sensitive to meet all Aboriginal and Torres Strait Islanders' needs. Ultimately, well-being is being impaired as without targeting these factors and overcoming them, the prevalence of this chronic condition will only rise and both impact individuals and communities and increase the mortality rate gap that exists between Aboriginal and non-Aboriginal peoples. Graph 1.2 clearly demonstrates the gap in life expectancy that exists between Aboriginal and Torres Strait Islanders and non-Aboriginal and Torres Strait Islanders. It is doubled in both Northern Territory and Western Australia. As mentioned earlier, these gaps exist due to both social and cultural determinants of health in the Aboriginal and Torres Strait Islander communities. The Department of the Prime Minister found that in 2016, nearly 3 in 4, which is 71%, of Indigenous deaths were from chronic diseases, including circulatory disease, cancer, diabetes, and respiratory disease. These diseases accounted for 79% of the gap in mortality between Indigenous and non-Indigenous Australians. This once again links back between culture and health, whereby their perception of health is as a community and not as an individual. An urban community is defined by areas that are very developed, meaning there is a higher density of structures such as buildings, roads, bridges, railways, and houses. Approximately half of all Indigenous Australians now live in major cities and inner regional areas. It is without doubt that it can be said that Aboriginal health has and will be greatly influenced by culture, and this will remain. I have discussed that it has affected their acceptance of the Western methods of treating illnesses. Therefore, nurses need to be providing appropriate, safe, and culturally competent care to both Aboriginal and Torres Strait Islander peoples. But how? The Nursing and Midwifery Board of Australia state that nurses should deliver bias and racism-free, holistic care which is based on the principles of cultural safety and respecting the Aboriginal and Torres Strait Islander people. It further states that nurses should advocate for and act to facilitate access to quality and culturally safe health services and to recognise the importance of family, community, partnership for both prevention strategies and care delivery. Secondly, a nurse is an educator. Registered Nurse Standards for Practice mention that nurses should provide the information and education required to enhance people's control over health. Indigenous people lack of knowledge about diabetes and how to prevent it, and hence nurses can play a key role on educating them. It's an obligation for nurses to educate and promote health among Aboriginal and Torres Strait Islander communities in order to enrich their knowledge about healthy lifestyles, food habits, and health hygiene. They can also teach the parents about the importance of providing a healthy diet to their children. In order to do this, nurses must firstly provide culturally competent and safe care. For example, according to their culture, it's recommended to not have direct eye contact with the elders, and they don't prefer opposite gender to do their health checkup. Nurses should be culturally wary and respectful about these. This may then pave the way for future generations and for those children when they begin to have their own family, so they can educate others as well as their own. Essentially, this creates the hope that the stigma between Aboriginal and Torres Strait Islander people and non-Aboriginal and Torres Strait Islander peoples will be eradicated, or until then, to decrease the prevalence of diabetes in not only urban communities but Australia-wide. Burrow states that evidence does suggest that primary healthcare services that apply continuous quality improvement will be able to identify improvements and clinical outcome measures in Aboriginal and Torres Strait Islander patients with diabetes. It is from conducting this research that as a group we have vastly explored the integral social determinants of health that have made an immense disparity in health status and life expectancy in Australia. We have noted observations for our own future nursing practice and acknowledging the respect and cultural awareness you need to create when treating or communicating with Aboriginal and Torres Strait Islander peoples, such as understanding the reasons why these individuals do not access healthcare services, which has ultimately created this inequity in health disparity to begin with. I can say, and my group would agree, that it is paramount to create a trusting relationship with Aboriginal and Torres Strait Islander people so they feel comfortable enough for you to assist them in any way possible. Nurses are, of course, educators, and we need to be the change and support that Aboriginal and Torres Strait Islander people need. Thank you.